So there's two main categories for headaches, primary versus secondary. Secondary meaning from something else, an illness or maybe an injury. But today we'll focus more on the primary headaches. Usually we talk about three main categories of primary headache: migraine, tension type, and what are called trigeminal autonomic cephalgias, or TACs. Migraine is one we talk about frequently. That one's a little bit different in that typically very severe or moderate in intensity. One side of the head, pulsating quality or throbbing, tend to get a little bit worse with movement. And then nausea, vomiting, light or sound sensitivity tends to go along with that one as well. Tension type a little bit different. Usually both sides of the head, a little bit milder in pain level, and may have associated tension in the shoulders, things like that. It doesn't have those other features that we talked about, like nausea, light, sound sensitivity, or worsening with movement. The other one is very rare, the TACs. Usually that's one side of the head or the eye, the temple. Very, very severe in some cases in level of pain. And that's a lot of features called autonomic symptoms, like tearing, runny eye, red eye, droopy eyelid, ear fullness, flushing of the face. So those are some features of the main headache types we'll talk about today.
I've heard chronic, episodic. Can you explain the difference between the two and maybe how frequency plays a role in that?
So episodic and chronic is differentiated just by how frequently the headaches are occurring. So chronic headaches or chronic migraine is defined as having headaches more than 15 days out of the month, a certain number of those being classic migraine attacks, and you've been in that pattern for at least 3 months. Episodic migraine would be considered less than 15 days out of the month. I get asked all the time, when should I see someone about my headaches? One thing I always like to tell people is if your headaches are affecting your quality of life, is one thing to look at, and two, how frequently you're having headaches. So if you're planning your life around your headaches, if you're turning down time with your family and friends, if you're missing work because of your headaches, we don't want that to happen. You should be living your life and your headaches should not be interfering at all. It's a reason to think about visiting with your provider about your headaches. And another thing to keep in mind is how frequently your headaches are occurring. If they're occurring at least on a weekly basis, you should really think about making an appointment with your doctor.
And touching on what could make someone go from episodic to chronic, medication overuse, that's a big one that I see a lot in patients. Other things that can worsen it, stress, big life changes, maybe even a head injury. So things that trigger migraine in general can make someone go from less frequent to more frequent headache. Now that's what we really don't want to happen, because once you get in the chronic pattern, it can be a little bit more challenging to treat. So we want to catch patients early when they notice that, hey, this is really starting to become an issue in my day-to-day life. Every week I'm missing something, I'm having to take a medication. That's when you should speak to your doctor.